What if I told you that one of the most heart-healthy habits in your kitchen could quietly increase your risk of a heart attack or stroke after the age of 60? I'm not talking about fast food, cigarettes, or obvious unhealthy choices. I'm talking about fruit. Foods many older Americans eat every single day believing they are protecting their heart. After more than 2 decades working with heart patients, I've seen something that still surprises families. People who faithfully follow their medications, attend their doctor visits, and try to eat healthier, yet suddenly develop dangerous blood clots, unstable heart rhythms, or strokes that seem to appear without warning. In many cases, the trigger isn't what they expected. It's a small daily habit that slowly interferes with blood thinners, heart medications, or the delicate chemical balance that keeps the heart beating safely. Today, I'm going to walk you through 5 fruits that can quietly increase the risk of heart attack or stroke in older adults, especially when combined with common medications. Because once you understand how these everyday foods affect the aging heart, you may never look at your breakfast table the same way again. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Grapefruit, the healthy breakfast fruit that can quietly turn your heart. Medication dangerous. Picture this for a moment. It's a calm morning in America, maybe Florida, Arizona, or a quiet suburb in Ohio. A retired couple sits at the kitchen table, sunlight coming through the window, coffee brewing, and half a fresh grapefruit on the plate. It feels like the perfect heart-healthy breakfast. But for many adults over 60, that simple habit can quietly interfere with the very medications meant to protect their heart. Here's what most people don't realize. Grapefruit contains natural compounds that block an important enzyme in the intestines called CYP3A4. That enzyme is responsible for breaking down many common heart medications before they enter the bloodstream. When grapefruit blocks it, the medication is absorbed in much higher amounts than intended. In practical terms, that means a pill your doctor prescribed at a safe dose can suddenly behave as if you took 2 or 3 times the amount. For seniors, that change is not trivial. Aging kidneys and liver already process medications more slowly. When grapefruit raises drug levels even further, side effects can become dangerous. Severe muscle injury from statins, dangerous drops in blood pressure, abnormal heart rhythms, or extreme fatigue that leads to falls. In some cases, these complications can trigger the chain of events that ultimately leads to heart attack or stroke. I remember a patient named Richard, a 72-year-old retired electrician from Texas. He had been doing everything right, taking his cholesterol medication faithfully, walking every morning, and trying to eat healthier. About a year earlier, he had started drinking a large glass of grapefruit juice every day because he read it was good for the heart. What he didn't know was that grapefruit juice can interact with certain statins and heart medications. Within months, Richard began experiencing unexplained muscle weakness and intense fatigue. At first, he blamed aging. Then one morning, he became so dizzy while standing up that he nearly collapsed in his kitchen. When we reviewed his routine, the culprit became clear. His medication levels were dangerously elevated due to daily grapefruit juice. Once he stopped the grapefruit and adjusted his treatment plan, his symptoms gradually improved. This is the situation many older Americans face without realizing it. Grapefruit itself isn't poison. The real danger appears when it's combined with certain medications commonly prescribed after age 60, cholesterol drugs, blood pressure medications, and heart rhythm treatments. Unfortunately, no warning appears on the fruit in your grocery store. If you're over 60 and take prescription medication for your heart, cholesterol, or blood pressure, the safest step is simple. Talk with your doctor or pharmacist before making grapefruit part of your daily routine. That one conversation could prevent a serious medical emergency. And if grapefruit can silently change the way your heart medications behave, Wait until you hear about the next fruit, because it's often sold as a superfood, yet in certain older adults it can quietly raise the risk of dangerous blood clots. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Pomegranate, the heart-healthy juice that can quietly interfere with your blood thinners. Not every health problem begins with junk food or unhealthy habits. Sometimes it begins with something you drink because you believe it's helping your heart. Pomegranate juice has been widely promoted across the United States as a superfood for cardiovascular health. Many older adults buy it specifically for that reason. You'll see it in grocery stores labeled as antioxidant-rich, heart-protective, and beneficial for circulation. And in moderation, for many healthy people, pomegranate can certainly be part of a balanced diet. But the situation changes once medications enter the picture, especially blood thinners and certain heart drugs. Pomegranate contains natural compounds that can affect the way the liver breaks down medications. In particular, it can interfere with the same metabolic pathways responsible for processing some cholesterol drugs, blood pressure medications, and anticoagulants. When those pathways are slowed down, the medication may stay in the bloodstream longer or at higher levels than expected. For a younger person, that might cause mild side effects. For someone in their 70s with multiple prescriptions, the consequences can become much more serious. One of my former patients, Linda, was a 68-year-old retired librarian from Arizona who had been living with atrial fibrillation. Because atrial fibrillation increases the risk of stroke, her cardiologist prescribed a blood thinner to prevent dangerous clots from forming in the heart and traveling to the brain. She followed every instruction carefully. She never missed a dose. Around the same time, Linda began drinking a large glass of pomegranate juice every afternoon because she had seen several articles claiming it cleans the arteries. It felt like a smart lifestyle change. Within 2 months, she began noticing frequent nosebleeds and unexplained bruises on her arms. At first, she assumed she had simply bumped into furniture or that the dry desert air was irritating her sinuses. But one evening, she experienced sudden dizziness and weakness while standing in her kitchen. In the emergency room, doctors discovered that her blood-thinning medication was acting far more strongly than expected. Her clotting levels were dangerously elevated, increasing the risk of internal bleeding. After reviewing her routine, the team realized the only significant change she had made was the daily pomegranate juice. Once she stopped drinking it and her medication levels stabilized, the bleeding symptoms gradually disappeared. Linda was fortunate that the issue was caught early before something far worse happened. Situations like this highlight an uncomfortable truth many seniors never hear. Foods that are perfectly healthy in isolation can become risky when combined with certain medications. Older adults often take drugs that require very precise balance, especially anticoagulants used to prevent strokes caused by atrial fibrillation. When that balance shifts even slightly, the body can move from protection to danger. Blood that becomes too thin raises the risk of internal bleeding. Blood that becomes too thick raises the risk of clots. Either scenario can lead to a stroke or a life-threatening emergency. This doesn't mean pomegranate is forbidden forever. It means seniors taking heart medications or blood thinners should never introduce large daily amounts of concentrated fruit juices without discussing it with their doctor or pharmacist. Because the next fruit on this list is even more surprising. It's a drink millions of older Americans use for urinary health, yet in people taking certain blood thinners, it can quietly destabilize clotting levels and set the stage for a dangerous stroke without any warning signs. 3. Cranberry, the everyday juice that can quietly destabilize your blood clotting. For many older Americans, cranberry juice feels almost like medicine in a glass. It's something people drink to prevent urinary tract infections, especially women who have dealt with bladder problems for years. It's sold in nearly every grocery store, recommended in health magazines, and often considered one of the safest daily habits. But what most seniors don't realize is that cranberry products can interfere with certain blood thinners, and that interaction can quietly push the body into a dangerous imbalance. The issue becomes especially important for people taking warfarin, one of the most common anticoagulants used to prevent strokes in patients with atrial fibrillation or previous blood clots. Warfarin works by carefully slowing the body's clotting system so that dangerous clots don't form inside the heart or bloodstream. But the medication requires a delicate balance. Too little effect and clots can form, leading to stroke. Too much effect and the blood becomes dangerously thin, raising the risk of internal bleeding. Cranberry juice can affect how the liver processes warfarin. In some patients, large or frequent amounts of cranberry products may intensify the medication's effect, pushing clotting levels outside the safe range. This isn't something you feel immediately. It often happens silently over days or weeks, which is what makes it particularly concerning for older adults. A patient I once saw, Robert, a 74-year-old retired mechanic from Michigan, experienced this firsthand. Robert had been living with atrial fibrillation for several years and was carefully managed on warfarin to reduce his risk of stroke. His medication had been stable for months. His blood tests were always within the safe therapeutic range. Then he developed a mild urinary issue and began drinking cranberry juice every day because a friend told him it would keep the bladder healthy. At first, nothing seemed different, but after about 3 weeks, he started noticing small bruises appearing on his arms and legs without remembering any injury. Soon after, his gums began bleeding slightly when he brushed his teeth. During his next routine blood test, his INR, the measure doctors use to monitor warfarin, had risen to a dangerously high level. His blood was clotting far too slowly. Doctors quickly adjusted his medication and asked about any recent diet changes. When Robert mentioned the daily cranberry juice, it immediately raised concern. Once he reduced his intake and his medication was carefully adjusted, his clotting levels gradually returned to normal. Robert was lucky. In more severe cases, uncontrolled blood thinning can lead to internal bleeding in the stomach, intestines, or even the brain. The important lesson isn't that cranberry juice is inherently harmful. For many people, moderate intake is perfectly safe. The real risk appears when regular consumption happens alongside medications that depend on precise clotting balance. If you take warfarin or another anticoagulant, any new daily habit, including juices, supplements, or herbal drinks, should be discussed with your doctor or anticoagulation clinic. Small dietary changes may seem harmless, but in an older body they can quietly shift the delicate chemistry that keeps your blood flowing safely. And the next fruit on this list may surprise you even more. Because it's something many seniors add to their breakfast, believing it supports heart health. Yet in certain situations, it can actually interfere with clot prevention and raise the risk of stroke. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Avocado, the popular healthy fat that can quietly weaken blood thinner protection. Sometimes the foods people add to their diet in the name of health can unexpectedly interfere with the very medications meant to protect them. Avocados have become incredibly popular across the United States in recent years. Many older adults began eating them regularly after hearing about the benefits of healthy fats and the Mediterranean diet. Avocado toast, avocado slices in salads, or half an avocado at breakfast now feels like a heart-smart choice. In many situations, it is. But for seniors taking certain blood thinners, particularly warfarin, avocados can create a hidden problem that few people recognize. Avocados contain vitamin K, a nutrient that plays an important role in the body's clotting system. Normally, that's a good thing. Vitamin K helps your blood clot when you're injured so you don't bleed excessively. but warfarin works by deliberately blocking part of that clotting process. That's how it helps prevent dangerous clots that can travel to the brain and cause a stroke. When someone suddenly increases foods rich in vitamin K, like avocados, the medication may become less effective. The body begins clotting more easily again, even though the person believes they are fully protected by their blood thinner. This doesn't cause immediate symptoms, which is what makes it so risky. Clots can quietly form inside the heart in people with atrial fibrillation and then travel to the brain without warning. I remember a patient named Carol, a 70-year-old grandmother from California who had been taking warfarin for several years after being diagnosed with atrial fibrillation. Her medication levels had been stable for a long time. Her routine blood tests always showed that her clotting balance was exactly where it needed to be. Then her daughter introduced her to a new breakfast habit, avocado toast. Carol loved it. It felt modern, healthy, and filling. Within a few weeks, she was eating a full avocado almost every morning. At her next anticoagulation clinic visit, her INR level, the number doctors use to measure how well warfarin is working, had dropped significantly. Her blood was clotting faster than it should have been. The medication hadn't changed. The only real difference was her daily avocado intake. Her care team adjusted her medication and asked her to keep her vitamin K intake consistent rather than suddenly increasing it. Fortunately, the problem was caught early, but if the imbalance had continued unnoticed, the risk of stroke could have risen dramatically. The lesson here isn't that avocados are dangerous foods. For many people, they're perfectly healthy. The real danger comes from sudden dietary changes in older adults whose medications depend on very precise chemical balance. And the next fruit on this list may surprise you even more, because it's commonly recommended for digestion and constipation, yet in some seniors it can quietly disrupt blood clotting and create a hidden risk for stroke. 5. Dried prunes, the digestive remedy that can quietly trigger dangerous heart rhythms. Sometimes the food that seems most harmless is the one that causes the biggest surprise in a cardiology office. Dried prunes are one of those foods. Many older Americans rely on them every day to help with digestion, especially because constipation becomes more common with age. Doctors often recommend fiber, and prunes are widely known as a natural solution. But for certain seniors, especially those with heart disease, kidney issues, or those taking specific medications, large amounts of dried fruit can create a hidden problem inside the body. Prunes contain a high level of potassium. Normally, potassium is an essential mineral that helps regulate heartbeat and muscle function. In a healthy body, the kidneys maintain a stable balance of potassium in the blood. But after the age of 60, kidney function often slows down. Add medications such as ACE inhibitors, potassium-sparing diuretics, or certain heart medications, and the body can begin to accumulate potassium faster than it can remove it. When potassium levels rise too high, a condition called hyperkalemia, the heart's electrical system can become unstable. Instead of beating in a steady rhythm, the heart may begin to slow down, skip beats, or fall into dangerous arrhythmias that can lead to fainting or sudden cardiac arrest. I once cared for a patient named Carol, a 76-year-old grandmother from Colorado. Carol had mild heart failure and was taking medication to help her heart pump more efficiently. Her doctor had also prescribed a potassium-conserving medication to support her blood pressure. Around the same time, Carol started eating several handfuls of prunes every day to help with chronic constipation. It seemed like a harmless change. After a few weeks, she began feeling unusually weak and occasionally lightheaded. One afternoon, while standing in her kitchen, she suddenly felt her heart flutter and had to sit down quickly because she thought she might pass out. At the hospital, blood tests revealed that her potassium level had climbed to a dangerous range. Her heart rhythm was becoming unstable, something that can escalate rapidly in older adults. When doctors reviewed her routine, the daily prune intake combined with her medications and reduced kidney function explained the sudden imbalance. Once her potassium levels were corrected and her diet adjusted, the symptoms gradually resolved. The key lesson for seniors is that foods rich in potassium, including dried fruits, can interact with medications and aging kidneys in ways that younger people rarely experience. Eating a few prunes occasionally is usually not a problem. But large daily amounts, especially alongside heart medications, can quietly push potassium levels into dangerous territory. For older adults managing heart disease, kidney conditions, or blood pressure medications, even healthy foods should be introduced carefully and discussed with a doctor or pharmacist. Because when we step back and look at all 5 of these fruits together, a much bigger and more important lesson emerges, one that could help you avoid a silent chain reaction inside your body that dramatically increases the risk of heart attack or stroke as you age. The quiet truth about aging hearts. Awareness today protects your tomorrow. One of the most important lessons from everything we've discussed today is this: as we grow older, the body becomes far less forgiving. The heart that carried you through decades of work, family life, and responsibility is still remarkably resilient, but it is also more sensitive to small changes that once seemed harmless. Foods, medications, and even daily habits that felt routine at age 40 can behave very differently after 60. Many seniors assume danger comes only from obvious sources: fast food, smoking, or lack of exercise. But the reality is often much quieter: a glass of juice with the wrong medication, a fruit added to the diet without realizing how it interacts with blood thinners, a mineral imbalance slowly building over weeks without noticeable symptoms. These are the kinds of subtle shifts that sometimes lead to serious problems. What makes this even more concerning is that many cardiovascular events happen when people feel safest, during sleep or quiet evening hours. Blood pressure changes overnight, heart rhythm slows, and the body's chemistry continues adjusting while we rest. If medications, electrolytes, or clotting levels are even slightly out of balance, the aging heart may struggle to adapt. That is why so many heart attacks, strokes, and dangerous arrhythmias are first discovered in the early morning hours. But the goal of this conversation is not fear, it is awareness. When older adults understand how their bodies work and how foods, medications, and daily routines interact, they gain something incredibly powerful: control. The difference between a preventable medical emergency and a healthy decade often comes down to small, informed decisions made today. Think about your health over the next 1 to 5 years. Many people in their 60s and 70s still have decades of life ahead of them. The choices you make now, reviewing medications regularly, discussing diet changes with your doctor, staying aware of hidden interactions, can protect your heart, your brain, and your independence. Growing older does not mean becoming fragile, but it does require becoming more attentive. The strongest protection for your future health is not luck, it's knowledge, careful habits, and the willingness to stay actively involved in your own care. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.